Welcome to today's segment. Burnout in healthcare is worse than ever. And here's how to fix it fast. By the end of this video, you'll have no problem kicking burnout out and potentially improving retention. Because not only will you know how to do it, but you'll be able to do it quickly and do a wonderful job helping your staff. You'll see, I've lived it. I've lived through extreme burnout and failing health issues. And I learned the hard way. Therefore, I had to design real lasting solutions and strategies to thrive. I know a thing or two about this. Remain to the end. We have a 60-second burnout recovery we'll share with you, and you won't want to miss it. What if I told you burnout isn't just affecting your staff? It's already deciding which of your best employees will leave next. Your most reliable people, the ones who never used to complain, are exhausted. They're showing up physically, but checking out mentally. They aren't leaving just for higher pay. They're leaving because they feel unheard, unsupported, and trapped in survival mode. But what if I also told you burnout is not inevitable? There's a way to catch burnout before it leads to another resignation letter or your desk. Here's a scenario that may resonate. Lisa was one of the best nurses, covered extra shifts, trained new hires, and genuinely cared about her patients. One day, Lisa walked into her manager's office and quit effective immediately. Her reason? I just cannot do this anymore. No one saw it coming, but Lisa had been burning out for months, if not years. And no one asked how she was doing until it was too late. Lisa's story isn't unique. Burnout builds silently, but there's a way to assess, address it, and reverse it before your best people walk out that door for good. If you want to keep your best people, you need more than an open door policy. You need a real proactive system to identify and fix burnout before it's too late. Step 1, assess burnout without fear of repercussions. Most healthcare facilities realize burnout exists at that level amongst their employees and staffers once they quit. But here's the truth. Staff won't admit most of the time where the struggle is if it feels like their job will be at risk. Here's a real-world strategy you can use. Implement anonymous burnout assessments that ask staff what they need, not just how they feel. Create safe spaces where healthcare professionals can talk openly without fear of retaliation. Invest in burnout accountability systems that your healthcare facility can partner with. These individuals are someone that your healthcare staff can talk to who isn't a part of your organization and feel safe to do so. This is something we do all too well for our clients, so it works. Step 2, master effective communication and conflict resolution. Burnout doesn't just come from long hours. It comes from unresolved stress, miscommunication, and feeling like no one listens. Train your leadership in active listening so staff feel heard before they feel hopeless. Try organizing and implementing client speak and solve meetings where staff can discuss frustrations with leadership and come up with actionable solutions. Teach your teams how to navigate conflict productively instead of letting resentment build. Implement self-care character building tracking logs, something we also provide digitally and physically to our clients already. Self-care isn't a luxury. It's a necessity. If your healthcare organization doesn't promote it, burnout will take over. Now, here's the way you can begin to implement a real-world strategy. Introduce self-care character building where your staff tracks small daily wins, not just work. Reward your healthcare professionals who actively take care of their well-being. Because a healthy healthcare professional is an engaged healthcare professional. I know, that sounded cheesy, but it's true. I also offer my micro-break strategies that actually work. Moments during the day where staff can actually reset, reflect, and recharge. See, a few weeks back in Georgia, we were speaking on the seriousness of burnout in the healthcare industry. But here's the real key. When these 3 steps I just shared are done right, burnout doesn't just slow down, it reverses. If this is your first time on Retention Revolution, we help healthcare administrators create real, lasting retention and resilience solutions for their staff to reduce burnout and potentially increase retention. If that sounds like something you need in your healthcare facility, hit subscribe so you don't miss the videos we have upcoming. Organizations that implement can see burnout rates drop up to 30%. Teams with strong communication and self-care initiatives retain their best staff longer. Imagine walking into your hospital and seeing your best staff arriving. No more last-minute resignations. No more emotional exhaustion. Just a strong, engaged, committed team. How would that feel? If you're ready to stop losing your best people and start building a workplace where they want to stay, click the link to provide your email. We'll send you a link to register for our free Healthcare Administrator HR Masterclass and tailor our training to your staff's unique needs. As promised, the 60-second Burnout Reset Formula. Step 1, the 5-5-5 rule. Breathe in for 5 seconds through your nose to the diaphragm. Hold for 5 seconds and exhale from your mouth slowly, counting backwards. Have your healthcare professionals identify one thing overwhelming them right now and write it down in one sentence. Step 3, take one small action immediately. Even a micro step creates momentum. Burnout isn't just about exhaustion. It's about clarity. Try this exercise and see how it changes your staff's energy. Click the Burnout Prevention resource link below, and it'll give you a free PDF that's helpful. Thanks for listening. Until next time.